Dear colleagues, welcome and thank you for your interest in our e-poster. My name is Ehlers. I'm from Witten Herdecke University, and in the next couple of minutes I want to talk about our study we made about digital transformation in healthcare, about a course we did in a virtual classroom, and an interaction analysis we made there. Digital transformation in healthcare is quite a big topic at the moment. We have seen robots in healthcare, robots in surgery. We are doing a lot of telemedicine. We use apps and variables. We have seen that artificial intelligence can help with diagnosis and treatment, maybe. Um, and we also learned a lot about precision medicine. And the question is this a focus in our medical curriculum? And when we look at the professional society for medical education, we see there could be some more digital transformation as a topic in a medical curriculum, and also digital learning as a method. In Witten-Herdecke, we have a model curriculum medicine, so we make a little bit different than the other universities there. We have an admission process. We have a total problem-based curriculum, working in small groups, no lectures, no clinical lectures, but very practically working in blocks in the clinics. And we have, that's quite special at our university, something we call Studium Fundamentale, and that may be translates as fundamental studies. 10% of each curriculum in all faculties, culture, economics, society, and also health, um, has to be done in these fundamental studies. There's the Thursday for this, where the students from all faculties can elect courses that they study in a transdisciplinary way altogether. That could be philosophy, that could be reflection, that could be learning about Karl Marx, that could be making music in the orchestra or whatever, and is made to widen the view and to learn about the world and society, and to learn to reflect also about your own professional identity. And that gave us the chance to make a course there about digital transformation in healthcare. We do that in a virtual classroom, um, where students from all faculties together can discuss about this digital transformation. There are students from economics, from philosophy, from culture, but also from dentistry, psychology, and medicine, and nursing. And you see, we started that course in winter 2016, very small. It was very unique. We made it in presence and online, and had about 17 participating students. From them, 10 made their certificate in that course. And then the topic grew bigger and bigger, as you can see. And in this summer, we had 357 participating students, 277 that made their certificate in that course. And from in the last past years, we did this course only online in a virtual classroom setting. If you want to learn a little bit more about the course, there's a publication we made to show how we are doing the course and how it is accepted by the students. In this study, we asked us the question, can a course in this size, where maybe more than 300 students are online, still be interactive, or is it a very old-fashioned lecture where only one person is talking and all the others have to consume to listen? Good thing about such a virtual course is that we can collect a lot of data. Here you see the schedule of the winter term 1920. This is the term that we evaluated, and you can see there are the topics um, from digital transformations, about artificial intelligence, about the Homo digitus, about insulin pumps, social media, electronic patient files, surgery robots, you name it. And you can also see there are a lot of lectures from our university, but from several faculties, but also from outside, external experts that share experiences of their company or their university. And as I said, we could collect a lot of data, so we could record all the sessions that we can have a second look into it, and we put them on YouTube so that also the students could have a second look into it if they want to see something again. If you are able to speak German, feel free to have a look on our YouTube channel and watch the video clips there. They are linked in this e-poster. But to do this study, we also had a lot of log files, so we could see who participated in the course. We could see how many persons were there online, but we also could see on an individual level when did they log on and when did they log off. So you see, this is a person only 3 minutes there, wouldn't be count. This is a person that was the whole time there. This is a person only 2 minutes, not be counted. So we could really see who participated really in the course and who just had a quick view in there. We had log files from all the polls also, so that we afterwards could see how many students participated in the polls, and maybe also which answers were the top answers. That would be focus of this study. And we collected all the chats, put them in an Excel file so that we could count how many persons were active, how many persons took part in the chat, and also do something like a content analysis to see was it a comment on social, technical, or on topic. So for our evaluation in the quantitative type, we had the number of participants and the comments, the number of commenting participants, and also the participation in polls. And as I said, for the content analysis, we looked, is it a social comment, maybe like good evening or sorry that I'm late, but also what can we do afterwards, shall we meet in town? So connecting and networking, which is for us quite important. We're a social university. We want that our students also socially interact, and it's great if they do that also in virtual settings. We also had technical comments. I have a problem with the internet connection. I can't find the button to start my camera, whatever. And of course, and maybe most important for such a course, the on-topic comments. Maybe some explanations how such a technique could be used. A nurse could make house calls with a digitally connected doctor when it's about telemedicine, and all these things where they exchange. The results you see in green here, the participants in each session. In that term, there was a mean value of 213 participants in each session. You see there are some sessions where more participants were and some were less were. And the blue, the active participants that at least once have written something in the chat. And as you also can see, we lost the chat logs from our evening number 12. So we have no values from here. You can see there was an active participation of 82.5% of the students. And we see how often do they comment. We see here the green bars, the number of the comments in each session. And there's a mean value of almost 500 comments per session, and when we calculate that through the active participants, 2.8 comments per participant. But to be honest, there are a lot of participants that only have one comment, and there are several participants that had 15 comments. And the result of the content analysis, we see the most comments were social comments, where students interact socially with each other. There also were technical comments, about 13%, and we see that could be questions. But, and that's nice for the lecturers and the teachers, that could also be answers. So if someone asks, okay, I have sound problems, I couldn't hear that on my headphone, then another one says, okay, there is a voice and audio assistant, click on these and that buttons, and then you will have better sound. So students help each other, which is quite nice for the teachers, that they don't have to solve all technical issues. So they could concentrate more on the on-topic comments, and you see it's almost a quarter of the comments were on-topic comments. You've seen on the slide before there are a lot of comments, so there's a very quick chat. That's sometimes a lot to do for someone doing the course and lecturing. So we normally work with several persons in there. Some moderate, and some just as an expert share their knowledge and experience. These are the results of the polls, normally multiple choice questions where you ask for opinions or understanding and these things. And you see there are some sessions that a lot of polls, 1 to 11, and some sessions that have no polls, number 4. Um, and a quite good mean value of participation in the polls. It's about 74%. And the minimum was 20, around 20. It's here in the last session questions that not everyone was able to answer, and the highest participation was almost 93%. Um, we have seen that there are some problems when students use the mobile version when they go by smartphone or tablet in this course to answer these polls. That makes them quite sad because most of them want to participate. Um, it's much easier when you do that from a laptop or computer. Some additional findings that we had when evaluating that, we see the on-topic discussion was a lot about own experiences. Most of the students already worked in the healthcare sector as a nurse or in a startup when they study economy or whatever, so they could share their own experience with digitization. There were a lot of discussions about moral and ethical questions. What is this, the use of robots in nursery or in care doing with the patients? Isn't that a problem when we send robots to old people? Or what about using step trackers for the fee on your insurance companies? Wouldn't that divide the society in several parts? So ethical questions that we discussed a lot. And there were practical examples where students explained where they have seen some digital devices in practice. We also learned that there's more interactivities when students do the courses. So we had here 2 students that were on an exhibition on digital medicine, the ExpoMed in Berlin, and they made a half an hour talk about what they've seen there, what they've learned there, to whom they've talked, and they had a lot of questions by their fellow students asking them about that. And we've also seen it's easier to ask experts from your own university than experts from extern. Um, so there were also more questions. The more polls we have, the more questions we had. So that raises also interactivity. A lot of students that only have the chance to make yes or no or what social media they use or whatever wanted also to explain why they use that and why they said that. So there was more interactivity in the chat. And we learned direct questions and therefore calls to action or calls to comment raise the interactivity. So if you ask, what do you think about this, or how could a robot be used in a good way in healthcare or whatever, then the students comment a lot and you get into discussion with them. We had the feeling there's much more interactivity in such a virtual lecture than it is in the same size face-to-face lecture. It's difficult to find numbers in the literature, but maybe it's easy to find an explanation. It needs a strong heart to interrupt a lecturer during his lecture and say, "Stop! Could you explain that again?" Or "Stop! I have made the same experience," or whatever. But it's much easier to write down that in a chat, and the lecturer can make a pause when it fits best for them. And also we have moderators that were in the chat moderating that, and you won't have that normally. That said, normally in a face-to-face lecture, it might be sensible to have that there too. We have seen a lot of publications about audience response systems. Here as an example, Gorgi and colleagues from 2009 that had the same participation in polls in a face-to-face lecture that we had here in our lectures, around 90%. We learned that it is a very easy way to invite external experts. Normally, when you have to do a lecture somewhere, you have to travel there, you maybe have to stay overnight, miss a lot of your own work and do your lecture somewhere else. Here, we could just ask them to go online, on a Thursday evening, 18 o'clock, and talk to our students from their offices or from their homes. So that was very great to get a lot of people, and a big variety of experts in this course. And that would make it also possible to create a lecture as a cooperation between universities. Normally we do research as cooperations, but we could also do this with education and with lectures. And we were in a very digital university before this summer. As you've learned, we are doing a lot of things in presence, very social, small groups. But then COVID-19 came and we had to change that a lot, and everything was digital. Even our small group problem-based learning was made in Zoom. And we learned a lot from this course how to make interaction possible in online courses. So it was a good sandbox to learn a lot about interactivity and also about virtual identity to do online courses. The take-home message is yes, virtual classrooms help to deal with current topics in an interdisciplinary and interactive way. And maybe you made the same experiences during this COVID-19 term. Would be great to exchange experiences, would be great to answer your questions. If you have some, please feel free to contact me via mail or social media, as you can see here. And it would be great if you're an expert, if you have something to say about digital transformation in healthcare, if you would like to discuss with our students, be part of your course, please contact me, and we will find an hour on a Thursday night where we could exchange about that. Thank you for listening. Enjoy the AMEE virtual conference and stay healthy.